All right, so we're going to be starting chapter 7. Chapter 7 gets broken down into three parts. So there's a part A, a B, and a C. It's a pretty long chapter, and there's a lot of details in this chapter. This chapter is on the skeleton, your skeletal system. Literally, the skeleton or skeletal system, skeleton, it's a Greek word. It pretty much basically means dried up body or a mummy. However, when you look at it, it's anything but. It's an engineer's, dream. There's no when you look at buildings, skyscrapers. Remember, what does skeleton do? The bones in your body. It provides a framework for your body. There's no building that's been produced by modern man that comes anywhere close to how perfect this the human skeletons the human skeleton, moreover the entire human body has been designed. So the skeletal system, it's made up of your bones, cartilage, joints, and ligaments. It is mostly bones that it's made up of, and in total, the skeleton, it accounts for roughly 20% of your of the mass of your body. So if you're thinking about it, for a 160-pound person, that's roughly translates into 30 pounds. Again, that's quite significant. However, bones, they're not that heavy individually. When you look at each bone, it's not, they're quite lightweight. However, being so light, they're still very strong. They're quite resilient to the demands that's placed on bones. Um, so aside from the skeleton consisting mostly of bones, we do find cartilage present as well. Now, cartilage, you find them in isolated areas of bone. So, for example, you find them at the parts of your ribs, okay, where the ribs, they connect anteriorly to the sternum. That's your breastbone. Also, you find ribs, for example, that make up part of your nose. You also find them at the ends of bones, at the end of the long bones, as articular cartilage. Um, and also, again, so you'll find them at joints. That's what it refers to. So now, when we go down to the next thing, ligaments, and we just spoke about joints. When you have two or more of bones that come together, that's where they form a joint. Okay, when you have two or more bones coming together, and that's what the ligament's job is to do. Ligament, they connect bones. They connect two or more bones, and they reinforce the joints. They allow the required movement while they restrict motion in other directions. So if you look at your arm, if you can flex it, okay, great, your bicep pops up. But then when you extend it, your bicep, it lengthens again. However, if you try to hyperextend it, it won't allow. Now, part of the reason why you're you can't bend your or uh, stretch out your arm anymore, extend it anymore, is because of the ligaments that are there to limit that motion. The other part is the skeletal joint itself, and you're going to be looking at that as we go through this chapter. Now, the skeleton is divided into two major divisions: an axial skeleton and an appendicular skeleton, and we discussed this in the previous chapter before. So, as far as the axial skeleton goes, now axial skeleton, again, as the name implies, it consists of everything that's pretty much in the midline of your body. Okay, the axis, and there's 80 bones that roughly make up your axis. Uh, Now, these bones, they're divided into three major regions. So you have the bones of your skull, the bones of your vertebral column. These are your backbones, and then the bones that make up your thoracic cage or your rib cage. Now, as far as the functions go for the axial skeleton, so the number one, it forms the longitudinal axis of your body. Number two, it supports the head, neck, and trunk. And number three, uh, it protects your brain, your spinal cord, and your thoracic organ. So this is quite very significant as far as, again, what it does, because these organs that you see over here, these are vital organs. And what you'll see is this: as you guys are, as you move through this entire course, you'll see that organs that are very important, they're very well protected. All right. uh, or actually, let me put it this way: organs that are delicate, they're very, very, very well protected. So your brain is very delicate. And remember what we just discussed in the previous chapters: when there is damage to the nervous tissue, it's not reversible. It cannot be repaired. So this is why the brain is completely 360 degrees. It's protected by your skull, the cranium. Same thing goes for your spinal cord. Your spinal cord, it runs down between the backbones. Again, it has protection 360 degrees. And the same goes for the thoracic cage. When you look at the organs that you find within the thoracic your cavity, you have your lungs and your heart. Now, if you're not able to breathe again, so you cannot live. So these lungs, they have to be very well protected. If you didn't have this protection, the lungs would bruise up, they would get damaged quite easily, and we would not be able to function as we do. Same thing goes for the heart. Again, if you don't have protection for the heart, and if there's any type of damage, trauma that results to the heart, if it was not protected by the bones that make up your thoracic cavity, then that heart would it would cease to function. It could possibly cease to function, I should say. So here you go. Now, everything you see in the midline of the body, this is your axial skeleton. So all of your limbs, they make up your appendicular skeleton. So if you look over here, you have your skull, okay, and then you have your rib cage, right? This is your thoracic cage, also it's called. And the thoracic cage, again, it's made up of your costals. Remember, that's your ribs, the sternum, and the backbones. All right. They also, because posteriorly, the costals, they articulate with the uh, the T1 through T12 of your vertebral column, the bones of your vertebral column. Um, so yeah, now we're going to be looking at all this stuff in detail as we move through the course, through this chapter actually. Now this is just another picture just showing you the posterior aspect, posterior view of the skeleton. So again, this is your clavicles over here, but remember this is part of your appendicular skeleton. So you have your clavicles, your scapula, your your humerus, your radius and ulna. These are your carpals, your wrist bones, the phalanges, your fingers, and then you have your hips. Okay, that makes up your pelvic the girdle. Actually, all these bones make up your part of your pelvic girdle. But so you have your hip bones over here, the ilium, and then you have your femur, and then you have your tibia and your fibula over there. The thin, skinny bones, the fibula, the thicker one, that's medial, that's your tibia. Um, so we're going to be looking at all these in detail, and it's quite fascinating. So the very first thing we start off with is the skull. So the skull, this is the most complex structure you have in your body, and it's formed by two sets of bones. Now the cranial bones, okay, which is also referred to as the cranium, it completely covers, okay, it encloses your brain within this cranial cavity. And in addition to that, exteriorly, it provides attachments for the head and neck muscles. So you're able to move your head. And then also the facial bones. Now, combine both the cranial and facial bones, there consists of 22 bones in all. So the facial bones, they provide the framework of your face. Okay, that's what it forms. That's his job. So on top of that, you have muscle and skin. It contains cavities also for special sense organs. So, for example, your eyeballs, your eyes, they sit in the orbitals. For taste, you have your tongue, and also your nose, smell. So these cavities, it's providing areas. Again, what is it doing? It's one of the things there that it does. Let's keep it very simple at this point. Is that it's there for protection. So it's protecting these sense organs also. Uh, it also it creates an area for air to pass through and for food to pass through also. Uh, the facial bones, they also secure your teeth, okay, the sockets that are there, the joints, they hold your teeth in place. And also, they anchor your facial muscles and that we use all the time to express ourselves. Now, most skull bones, they're flat and they're firmly locked together by joints that we call sutures. And we're going to be looking at these as we move through this chapter. The exception is the mandible. The mandible, it articulates. Okay, and the mandible, we're talking about your jawbone. So this is not sutured. Now, whenever you have a suture, it's an immovable joint. All right. Uh, and when you look at it in appearance, it has a serrated sawtooth appearance. So when you look over here in this picture, these are the, the sutures that we see here. So this is the lambdoid suture. First of all, this is the occipital bone. This is the parietal bone that forms the vault for your cranium. This is your frontal bone, your sphenoid, and this is the temporal bone. Now we're going to be looking at all these in detail. But yeah, these sutures, okay, they connect all the bones together. This is what keeps them in place. And remember, these are not movable. In adults, they do not move. Um, you look at this coronal suture again. It forms between the frontal and the parietal bone. You have this lambdoid suture. It forms between the parietal and the occipital bone. The squamous suture again is between the temporal bone and the parietal bone. So we're going to be looking at all these in detail as we move through. Yeah, the facial bones, they form the anterior aspect with the cranium forming the rest of the skull. Now the cranium, it gets divided into a vault and the base. So the vault, think of it like this. This is the kind of the upper part. Think of it like a baseball cap. When you put a baseball cap on, the part that fits on on the top of your head, that's your vault. It's also called the calvaria. So it forms the superior lateral and posterior portions of the skull, as well as your forehead. Now the base, okay, the cranial base, this forms the inferior aspect of the skull. This is the part that the brain actually is sitting on top of. All right, it's sitting inside of. So internally, the base gets divided into three fasciae or three steps that they call it: an anterior, middle, and a posterior. And again, within these three fasciae, you have the brain that's sitting there. And then on top, superiorly, it's being protected and covered by your cranium, the vault, okay, or the calvaria. So this entire area that the brain is sitting inside of, sitting on top of, that's referred to as the cranial cavity. So here you go. This is your cranial cavity over here. So this is the anterior cranial fossa. This is the mid cranial fossa, and then over here you have the posterior cranial fossa. So this entire space, guys, this is where the brain sits. Okay. This is a lateral view of the brain and the skull. So again, you can see the different parts of the brain that they're sitting. The frontal lobe is over here. The temporal lobe comes in the middle, and then the posterior lobe of the brain, it comes all the way in the occipital. It's bordering the occipital your occipital bone that makes up your skull. So let's move forward. So the cranium, it also contains other cavities aside from the three that we mentioned. Now these are the middle and internal ear cavities. So this is again, your inner ear and your middle ear, the nasal cavity, and also the orbits that we talked about earlier. Remember, the orbits, they hold your eyeballs in place. Now the skull, in addition to these cavities, it has 85 openings. And they're named after, again, they could be the size, their shape. Some of them are called foramina, others are called canals, some are referred to as fissures. And they provide passageways for your spinal cord to exit for the nerves that go up and down from your brain, by your spinal cord to exit. So that's through the foramen magnum. Okay, that's the largest opening that you have in your entire body, actually, the foramen magnum, and that your spinal cord passes through it. Major blood vessels, they also will go through some of these canals or foramina. In addition to the cranial nerves, you have 12 cranial nerves that exit your skull at various points. So again, they're showing you over here, look, you have your cranial cavity, you have the orbits, you have your oral cavity. But in addition to that, there's other structures, there's sinuses, these are air-filled cavity. And one of the things that they do, among other stuff, is that they help lighten the skull. They help take the weight off of it. So for example, when you're looking at these ear cells in the ethmoid bone, okay, or these frontal sinuses, these are all these little cavities that are filled with air. So your frontal bone, it's a shell-shaped bone, and it forms the anterior cranium. It articulates posteriorly with your two parietal bones, your right and left parietal bones, and it does this by way of the coronal suture. Okay, now the most anterior part of your frontal bone is the vertical squamous part, and more commonly it's known as your forehead. Now the frontal squamous region, it ends inferiorly at the supraorbital margins. Now this is the thickened margin of your orbit. So if you feel that bump that's right underneath your eyebrows, this is that supraorbital margin. From this point, the frontal bone it extends posteriorly, forming the superior walls of the orbits and most of the anterior cranial fossa. This fossa it supports your frontal lobes of the brain. Now, each supraorbital margin it gets pierced by the supraorbital foramen, sometimes also called the supraorbital notch. This allows the supraorbital artery and the nerves to pass to the forehead. Now, the smooth part of your frontal bone between the orbits, this is called the glabella. Now, glabella, if you guys ever, again, you watch one of these 90210 shows, for example, or what is this? These cosmetic surgery shows. A lot of people, you start to get wrinkling right over here at this part, this glabella. So when you see the doctors are giving these injections, this is the part that's the muscle that you find over here in this region in the glabella. That's what they're injecting. So just inferior to the glabella, you have the nasal bone that meets at the frontonasal suture. Now, the areas that are lateral to the glabella, internally you're going to find sinuses there that are called the frontal sinuses. So when you look over here, again, so this is your frontal bone right over here, and this is the glabella right over here, and this is so this right over here. This is this frontonasal suture. So this is where the nasal bones they meet this frontal bone at the glabella at this point right over here. Uh, this is this supraorbital foramen or the supraorbital notch that we talked about, where you have the arteries and the nerves that are passing through. Uh, right over here, you have this parietal bone. So you got your right and your left parietal bone. This is your temporal bone. The temporal bone doesn't articulate with this with the frontal bone, but the parietal bone does. Um, what else do we see here? It's pointed out. So yeah, this is a supraorbital margin. All right, so right above over here, you have your eyebrows around this part right over there. Um, what else? So we're going to be looking at this is your mandible now. So again, you have a nice anterior view. This is your mandible. This is your maxilla. Um, this is part of your well, here, let's look over here. This is part of your sphenoid bone, the greater wings of your sphenoid bone. This is part of your ethmoid bone right over here. Uh, this is your zygomatic bone, or you refer to as your cheekbone. Uh, let's see. This right here, this is your lacrimal bone over here. We'll be looking at these in detail, so it's just good to look at them now, so you can have something to refer to. But make sure as you're reading these through the book, you go back and you refer to the picture, so you're able to put an image next to the name as to what you're reading. This is the best way to study and to help you memorize. So again, when you look over here, this is a superior view of the calaveria. This is a foramen magnum. Remember I was saying this is the largest opening you have in your body, and this is where the spinal cord it enters, or it leaves the brain, depending how you're looking at it. Because remember, you have nerves that are going down or coming back up that are found within the spinal cord. This is your so again, this is the part of your frontal bone right over here, and this is where the frontal lobe of your brain sits over here. Um, what else do we have? We have again more. So this is called an optic canal. So you have your nerves that are coming through here, optic canal. This is the foramen rotundum, foramen ovale, foramen spinosum. So notice you have a right, you have a left also. Okay, so again, they're symmetric. You have internal acoustic meatus. You have a jugular foramen over right over there. You have a hypoglossal canal over here. And we're going to be looking at all these structures to see, what they're there for, what purpose they serve. But remember, all these little openings that you see, usually you'll have nerves that are entering or exiting, or blood vessels. Again, this is another picture, photograph of the skull. So over here, again, it's another picture of the foramen ovale over here. It's very hard to see the foramen rotundum over here, but you can see the optic canal quite clearly over here. So this is jugular foramen. It's quite prominent, and again, you have your the foramen magnum here. So the parietal bones and the major sutures. So let's look at this now. So the two large parietal bones, they form most of the superior and lateral aspects of your cranial vault. So remember, you have a right parietal bone and a left parietal bone. The four largest sutures you have, you're going to find them where the parietal bone articulates with the other bones, so where they form the joints. So those four are number one, the coronal suture. So the coronal suture is where the parietal bone meets the frontal bone anteriorly. Okay. The sagittal suture is where the parietal bone meets superiorly at the cranial midline. Now the lambdoid suture, excuse me, this is where the parietal bones, they meet the occipital bones posteriorly. And the squamous, the last one, the squamous suture, the squamosal suture, this is where the parietal bones and the temporal bones, they meet on the lateral aspects of the skull. So when you look over here, here we go. You can see the frontal bone and this parietal bone. Again, they meet at this the coronal suture. And then you have this parietal bone and the temporal bone, and you find this squamous suture. And then you have the lambda suture, where you have the occipital bone and the parietal bones meeting. Now, the one that we don't see is the sagittal suture, because again, that's you're going to find uh, there it is, right over here in this picture. So again, you have the superiorly, where the two parietal bones meet at the midline. You have this sagittal suture that we find forming. Now, this is the superior on the nuchal knot, the nuchal line that you find. This is the external. Where is this? Right over here. This is the external occipital protuberance. So if you feel that bump in the back of your head, this is what you're feeling. This external occipital protuberance. And again, these are areas that muscles attach to. Um, what else? So you can see the occipital condyles over here, and this is a part of the skull that's going to be articulating with your vertebral column, the very first bone, which you'll learn. It's C1. This is the part that's going to be sitting on top of C1, your first cervical vertebrae. And over here, you see some of these sutural bones over here also. That are formed. Again, some people may have it, other people may not have it. It's just you have this idiosyncratic variation. So again, another picture over here. It's nicely color coded. You can see the temporal bone. You can see the external acoustic meatus over here. This is called the mastoid. I'm sorry, this is the mastoid process over here. This is a styloid process over here. Now you have muscles that are attaching here also. Okay, so remember, styloid process is long, thin one. The mastoid is it's a larger, bumpy one. So with the bump you feel behind your ear, this is that mastoid process that's there. Um, so this is your zygomatic bone. This is a zygomatic process, okay, or the arch. Um, and then you can see the sphenoid bone over here also. Um, and then internally again, you have this your ethmoid bone over here. So let's move forward. Again, so over here, this is a picture, a photograph of the skull, and you see the same thing over here. This is the squamous suture, and you have the coronal suture over here. And then over here, you can see so this is the occipital bone over here. So you see the lambdoid suture over here then, in that case. Then your mandible, the mental foramen. Again, you have a nerve that runs through here. Um, so let's just move forward. Again, another picture. Lots of drawings. So internally, this is what you would see. So you have your again the parietal bone here, the frontal bone there. This is your temporal bone over there, and the occipital bone right over here. Your cross section, mid sagittal. So again, this is a photograph that shows you the same thing. So now we're going to be looking at the occipital bone. So the occipital bone, it forms most of the skull's posterior wall and its base. So internally, the occipital bone, it forms the walls of the posterior cranial fossa. And this is the part that supports the cerebellum of the brain. Now, in the base, since we're talking about the internal parts, so now in the base of the brain, remember I told you, you had the largest opening in the body. This is that foramen magnum. So through this foramen magnum, this is where the spinal cord and your brain, they come together. They meet at this point. They meet because of this foramen magnum that's there. This is the opening that allows for the connection of the two things. Because remember what we said. Both these structures, they're surrounded by bones for protection. So since we're there, as we go down, these you also find these occipital condyles at the base, at the inferior most the surface. So these they're kind of like a rocker like projections. They articulate with the first uh, the first vertebrae that make up your vertebral column, which we call C1. Okay, they're the first cervical vertebrae. Um, Now, when you look medial and superior to each occipital condyle, you find this hypoglossal canal. And it's through this hypoglossal canal you have cranial nerve 12, which passes through. So this is this hypoglossal nerve, okay? Cranial nerve number 12. Going back over here, anteriorly, the occipital bone, it articulates with your parietal, your temporal, and the sphenoid bones. So the external occipital protuberance, you find is just superior to the foramen magnum. It's a bump, and you have this the trapezius muscle that attaches to this. This trapezius muscle is what allows you to move your head upwards. So like if when you're moving your head back and you're like looking up, that's what this is that muscle, that trapezius muscle that allows you to do that. Now, in addition to this external occipital protuberance, you also find the external occipital crest and the superior and inferior nuchal lines. Again, these are areas for where you have ligaments and again other muscles that are attaching over here to the base of the skull. So when you look over here, again, this is the external occipital protuberance right over there, and then you have your superior nuchal line over here. Uh, this is that external occipital, the crest over here. This is the inferior nuchal line. So remember, you have a superior and inferior nuchal lines. You have the external occipital crest, and then above there you have the protuberance over there. So this is that area that we're talking about. So this is where this trapezius muscle comes and attaches to at this part. When you look over here, lateral to this foramen magnum, you have these two the occipital condyles. Now remember, this is the part of the skull that's articulating with your first cervical vertebrae, your C1. And then when you look medially to these condyles, then you see this foramen magnum that's present. So this is an inferior view of the skull. So as we go along, again, in this picture, it's the same thing. These are the occipital condyles right over here. And then this is your foramen magnum over here. Again, you can see the external occipital protuberance over there, and you can see the nuchal lines over here. What else? So the temporal bone. So the temporal bone, the best way to look at it is through the lateral aspect of the skull surface. So these temporal bones, they lie inferior to the parietal bones. Your right and left parietal bones. So again, you have a pair of them, your right temporal bone and left temporal bone. So they meet these parietal bones at the squamous suture. So the temporal bones, they form the infralateral aspects of the skull and part of the cranial floor also. Now the temporal bone, it gets divided, or it's easier to describe in according to three regions of this bone. Now the very first region of this bone, or the major region, is the squamous region. So just inferior to the squamous suture, this is where the squamous bone it lies. You're going to find it over there. Excuse me. Uh, it has a barrel-like zygomatic process that meets the zygomatic bone of the face of your face anteriorly. Now, together, these two structures, they form this zygomatic arch, and this is the bump or this projection that you feel. This is the part of your cheek that you're able to feel, your cheekbone. This is zygomatic, the arch. There's also a small oval mandibular fossa. Okay, this is on the inferior surface of the zygomatic process, and this receives the condyle of your jawbone, your lower jaw, your jawbone, called the mandible. So this is what forms this free movable temporal mandibular joint. Okay, now the next part, the tympanic region of the temporal bone. This surrounds the external acoustic meatus, or again, more simply put, it's the external ear canal, and this is where sound is able to enter your ears. Uh, so the external acoustic meatus and the eardrum at the deep end, these are part of the external ear. Now, before we get to the petrous region, The mastoid and styloid process, let's just talk about them quickly also. Um, because now the styloid process, when you look at it, it's a sharp projection of bone. It's a long, skinny, cone-like projection. It's found below the external acoustic meatus. Uh, this is an attachment point for some of your tongue and neck muscles, and for a ligament that secures this bone that you find in your neck called the hyoid bone. Okay, to the skull. The mastoid region now of this temporal bone. Uh, it has this real rough part that's called the mastoid process. So if you feel behind your ear, you feel that big bumpy part that's underneath, posteriorly and under your ear. This is that mastoid process. Um, there's this stylomastoid foramen that you find here, and between the styloid and mastoid process, this allows the cranial nerve number 7, which is the facial nerve, to leave the skull. Okay, so this is what's importance that this process serves, because this is where you find this stylomastoid foramen over here. Now let's go back to this petrous region now. So this petrous region, this is the deep part of the temporal bone, and it contributes to the cranial base. So it looks like a miniature mountain ridge between the occipital bone posteriorly and the sphenoid bone anteriorly. The posterior slope of this ridge, it lies in the posterior cranial fossa. The anterior slope is in the mid cranial fossa. Together, the sphenoid bone and the petrous portion of the temporal bone, they make up your middle cranial fossa. Okay. Now, this middle cranial fossa, it supports the temporal lobes of your brain. Also, within the petrous region, we find the middle and the internal ear cavities. Okay, and they contain the sensory receptors that are responsible for both hearing and for balance. Now, we also find several foramina that penetrate the bones of the petrous region. So the very first one is it's a large jugular foramen, and we find this at the junction of the occipital and the petrous temporal bones, and this allows for the passage of the internal jugular vein and cranial nerves number 9, 10, and 11. Now, just anterior to the jugular foramen, we find the carotid canal. And the carotid canal, it allows for this internal carotid artery to pass into the cranial cavity. Now, between the petrous temporal bone and the sphenoid bone, we find this foramen lacerum. And in living persons, in living organisms, you're going to find this covered by tissue, by cartilage. But in when you look at a dried skull, it's not there. Now, also the internal acoustic meatus, you're going to find this superior lateral to the jugular foramen, and this allows uh, the passage of cranial nerves number 7 and cranial nerves number 8. So when you look at this photo here, again, this is the bone of interest that we're looking at. This is this temporal bone. So notice the squamous suture you find again. That's lying that allows it to articulate with the parietal bone superiorly, and then we have this osteomastoid suture also that articulates with the occipital bone. Okay. Now this is this mastoid process here. This is the styloid process right over there. This is the bone where the tongue and the hyoid muscle, the hyoid bone attaches to also. That structure, and this is your external acoustic meatus. Okay, and then this is the zygomatic process, and this is the zygomatic bone. So again, when you talk about your cheekbone, okay, this is what we're talking about. Okay, this arch over here. And then we have right over here. This is this is where this mandible it meets over here uh, to form this temporomandibular joint. Okay, you cannot see it here. Maybe in another picture we'll be able to better see that. Again, same thing we're looking at. This is actual photograph instead of an illustration. So you have your styloid process there, the mastoid process here, the external occipital, the external acoustic meatus, and then you have your temporal bone right there. And then again, you can see the squamous suture at this point. So this is just again they've removed this bone out of place. okay, from the skull. Now you're looking just at this bone itself. So again, this is external acoustic meatus here. This is a zygomatic process. Okay, that's right there, zygomatic process. And then you have this is the petrous part, the mastoid process, styloid process. This is that mandibular fossa. So this part here, you can see it pretty good over here. This is what's going to be articulating with the mandible, okay, your lower jawbone. So again, another photo over here that shows you this. This is you can see the mandibular fossa very easily over here. And again, this is your zygomatic process, okay? This point is your cheekbone, and this is his entire temporal bone over here. Um, this is that petrous part of the temporal bone that we talked about, the innermost part of it. This is that foramen lacerum that we talked about. Again, this is what's going to be covered by the cartilage in living or individuals. Uh, this is that carotid canal you can see over there. This is that jugular foramen. This is that stylomastoid foramen. The external occipital, the external acoustic meatus is over there. Okay. Again, another view, superior view of the skull with the clavera that's been removed. So you can see the petrous part of the temporal bone very clearly over here. So again, this what forms the mid cranial fossa, the middle cranial fossa. And you can see the internal acoustic meatus over here now. And there goes the jugular foramen right over there, over there. So the mastoid process is full of ear cavities, the mastoid sinuses, or these mastoid ear cells, as they're called. You find them in the middle ear cavity. You find them adjacent to the middle ear cavity, and because it's so close to this mid ear, it has a very high. It's situated in a very high risk area. Because if you end up having a throat infection that spreads, then it goes to the middle ear. Well, because that bone is right next to the middle ear, it can spread to this area as well. So a mastoid sinus infection, or in other words, we call it mastoiditis. This is a very difficult and very difficult infection to treat. Also, it's dangerous because these air cells, they're separated from the brain by only a very thin bony plate. There's a potential that the infection could spread to the brain. Back in the old days, when people kept on getting this, if it happened over and over again, they just ended up removing this bone. Now today, fortunately, we've got antibiotics, and we have a very broad range of antibiotics that we can administer, so there's no need for surgery. So the sphenoid bone, this is a butterfly-shaped or a bat-shaped bone. It spans the width of the middle cranial fossa. This is considered a keystone of the cranium because it forms a central wedge that articulates with all the other cranial bones. It's a little bit hard to study because of this, this very complex shape that it has. So to help ease it, again, we ended up dividing into different regions. So those parts that we divide them, we divide into a central body, and then we divide into a greater wing, a lesser wing, and the pterygoid process. Um, so this is how again we're able to study this a little bit better. So again, when you're trying to describe something, you describe somebody. Oh well, this structure is on the greater wing, or on the lesser wing. It helps easily to be translated and described as to what you're looking at. Within the body of the sphenoid, we have the pair of sphenoid sinuses. Um, the superior surface of the body, it bears a saddle-shaped structure, okay? And we call that the sella turcica. And this means Turk saddle. Literally, that's what it translates into. So the seat of the saddle is called the seat of the seat of the fascia. It contains what we call this hypophyseal fossa, and it forms a very nice enclosure for your pituitary gland to sit on top of, right? Um, so the three processes that I described, aside from the body, again, the greater, lesser, and the pterygoid, the greater wing, lesser wing, and the pterygoid process. So the very first part, the greater wing, again, this projects laterally from the sphenoid bone. It forms part of the middle cranial fossa. Um, it also forms the dorsal walls of the orbits, and it forms the external wall of the skull, where you can see then this has like this flag-shaped bone area that's medial to the zygomatic arch. Uh, Now, the horn-like lesser wings, they form part of the floor of the anterior cranial fossa and part of the middle walls of the orbits. Uh, the the pterygoid process, this projects inferiorly from the junction of the body and greater wings. Uh, they anchor the pterygoid muscles, and these are very important in chewing. Also, we find a number of openings in the sphenoid bone. These are they're visible. Again, when you're looking at it, they're not hidden. So again, you can see this quite easily. So you have these optic canals. They lie anterior to the sella turcica, and they allow the optic nerves, okay, which is cranial nerve number 2, to pass to the eyes. Now, on both sides of the sphenoid bone, you have this crescent-shaped row of 4 openings. Now, the anterior-most of these is the superior orbital fissure, and this is it's a long slit that you find between the greater and lesser wings. Now, it allows the cranial nerves that control eye movement, and these are cranial nerves number 3, cranial nerves number 4, and cranial nerve number 6. It's easy to see. It's most easy to see this fissure in the anterior view of the skull. Now, the foramen rotundum and foramen ovale, they allow the passage of for the branches of cranial nerve number 5, which are the maxillary and the mandibular nerves, to reach your face. Now, posterior lateral to the foramen ovale, you have this small foramen spinosum, and it allows for the middle meningeal artery to pass through. So when you look over here, again, so this is your sphenoid bone. Again, if you want to describe it as a bat-shaped or a butterfly-shaped, whatever makes you happy. So over here, when you look at it, this is the greater wing. Okay. Now this is at the hypophyseal fossa of the sella turcica. This is where the pituitary gland comes and sits in right over here. It's this little groove. It's that fossa that they're talking about. Now this is a lesser wing. Okay. So you have your greater wing and then your lesser wing over here. Okay. So it's all lesser wing, and then greater wing, greater wing. Uh, right over here, these are the optic canals, and then over here you have the foramen rotundum, and then right over here it's difficult to see, but you're going to have your supraorbital fissure over there. It's going to be present. This is the foramen spinosum, down over here, the foramen ovale, uh, and let's look at the posterior view. So posterior view, again, you can see the body of the sphenoid bone over here. And again, you can see the greater ring over here much clearly, and then also down over here you'll see the pterygoid process that appears over here. And again, you can see the superior orbital fissure also that you find over here. And then you see the lesser wing over here. Okay, so you got your greater wing and the lesser wing. So this is a superior view, this is a posterior view. So you're looking at this from the top, and you're looking at this from the back. Now, next we're going to be looking at the ethmoid bone. So the ethmoid bone, this is, again, just like the sphenoid bone, this is also a delicate bone. It has a complex shape as well, just like the sphenoid bone. And you find this lying between the sphenoid and the nasal bones of your face. This is the most deepest bone that you have within your skull. It forms most of the bony area most of the bony area that you find between the nasal cavity and the orbits. Now, the superior surface of the ethmoid bone is formed by a pair of horizontal cribriform plates. Okay, and the cribriform plates, it helps form the roof of the nasal cavity as well as the floor of the anterior cranial fossa. Now, the cribriform plates, they're penetrated by the olfactory foramina, and these foramina, they allow the passage of the olfactory nerves to go from the smell receptors in the nasal cavities to the brain. Now, projecting superiorly between the cribriform plate is a triangular process that's called the crista galli. Now, the crista galli, what it does is that it allows the outermost covering of the brain, your dura mater, to attach to this structure, and it helps secure the brain within this cranial cavity. Now, we also have these perpendicular plates of the ethmoid bones. Now, these project inferiorly in the median plane, and they form the superior part of the nasal septum, which divides the nasal cavity into your right and left halves. Now, flanking the perpendicular plates on each side, you have a lateral mass. Okay, that contains the ethmoid sinuses, which are also called the ethmoid ear cells. So extending medially from the lateral masses, we have this delicately coiled superior and middle nasal concha. Now, the lateral surfaces of the ethmoid's lateral masses, they're called the orbital plates because they contribute to the medial walls of the orbits. Here we go. This is our ethmoid bone, and notice. So this is the orbital plate over there. These are these ethmoid ear cells that you see. This is that perpendicular plate that you see. So this is what makes your right and left halves. The middle concha is right over here. This is your left lateral mass, and this would be your right lateral mass. This is the crista galli over here. Uh, let's see another picture. Okay, so over here you can see it's a little bit more difficult to see, but you can see the ethmoid bone over here, and there. Uh, what else? You can see a little bit over here. Okay, this is the perpendicular plate you can see, and you can see a little bit of the middle nasal concha over there. Over there, your right and left middle nasal conchas. I think that's about it. You cannot see that much more detail. Now in this view, however, again you can see the crista galli very clearly. You can see the cribriform plate very easily, and then also you can see the cribriform foramina. Um, and so again, remember you find this within that anterocranial fossa. Now we're going to be talking about sutural bones. So as first of all, as I mentioned earlier, you're going to have idiosyncratic variations. So not everybody is going to have these sutural bones, or somebody does. If two people do have them, they may not be at the same place. So this is what I mean when we talk about idiosyncratic variation. You have variations within individuals. Some people have them, other people don't. Now, that said, these sutural bones, they're tiny, irregular shaped bones, or sometimes you end up finding them in clusters, or bone clusters, that you find within the sutures. Most often, usually, you find them within this lambdoid suture. Structurally, they're they're not important. Do they have any significance? No, it's unknown. We don't even know. But again, like I said, not everybody has them. Some people do, some people don't. It doesn't make you any more special or enhanced if you have it compared to somebody that does not have it. So when we look over here, again, over here you can see again. So this is that right here. You have this sutural bone over here. You got another one over there. So yeah, usually you're gonna find it right over here. Okay, this region within this lambdoid suture. We're going to be going in and looking at the facial bones now. So your facial skeleton, it's made up of 14 bones. 12 of them, they're paired. The mandible and the vomer, these are single bones. So again, you have one mandible, you have a pair of lacrimal bones, a pair of palatine bones, you have a single vomer bone, and then you have a pair of inferior nasal conchae. In addition to that, you have one pair of nasal bones, a pair of zygomatic bones, and a pair of maxillary bones. So the very first facial bone we're going to be talking about is the mandible, and this is the largest and strongest bone of your face. This is a U-shaped bone. Again, that's part that forms your commonly known as your lower jawbone. Uh, it has a body which forms the chin, and it has two upright, what we call branches or rami. Each ramus, it meets the body posteriorly at the mandibular angle. Now, at the superior margins of each ramus, we find two processes that are separated by the mandibular notch. So we have this anterior coronoid process, and then we have a posterior mandibular condyle. Now, uh, the anterior coronoid process, this is an insertion point for the large temporalis muscles that lifts or elevates your lower jaw when you're chewing. Now, the posterior mandibular condyle, this is the part, and we discussed earlier, that articulates with that mandibular fossa of your temporal bone, and this forms that temporal mandibular joint. Okay, temporal mandibular joint, TMJ. Now, the mandibular body, it anchors your lower teeth. Okay, its superior border is called the alveolar margin. Okay, that's once again it's alveolar margin, and it contains sockets. Okay, which we refer to as the alveoli, in which so within these alveoli, you have teeth that are embedded. Okay, that are held in place. Now, in the midline of the mandibular body, you have this slight depression, and that's called the mandibular symphysis. The mandibular symphysis, this shows where the two mandibular bones they came and they fused together during infancy. Also, we find large mandibular foramina on the medial surface of each ramus, and these ramus they permit the nerves that are responsible for tooth sensation to pass to the teeth in the lower jaw. So, a dentist, if you go to one, they'll inject like a numbing medication, typically Marcaine or lidocaine, into these foramina to numb this entire area while they're working on your lower teeth. We also have this mental foramina. Now, the mental foramina, these are openings on the lateral aspects of the mandibular body, and this allows blood vessels and nerves to pass to the skin of your chin and your lower lip. So when you look at your picture over here, now here you go. So this is your entire mandible, here your lower jaw. So over here, this is the coronoid process, and this is that the so this is the mandibular fossa of your temporal bone. All right. So and then you have this the condylar process over here. So this condylar process it articulates with the mandibular fossa. So this forms this this entire part forms this temporal mandibular joint. And remember, to the coronoid process, you have muscles that attach that allow you to chew food, or one of the muscles that allows you to chew food. You had this mental foramen that we discussed earlier. Remember, you have these blood vessels that pass through here and some nerves that go to your chin and your lower lips. Also over here, this is that mandibular foramen. This is what a dentist would probably want to inject lidocaine to numb your lower jaw. So this is that mandibular angle, and these are the ramus. So this is one ramus here. This is the other ramus over here of it, and this between the two. So you have this condylar process and the coronoid process. So remember, between the two processes, you have this notch, this mandibular notch. Also, just something to, I'm not going to give too much detail at this point, but if you're just looking at a skull, and just by looking at the angle of this mandibular angle of this facial bone, you can distinguish whether, with a good, the high likely of certainty, whether the individual is a male or a female. So again, it's depending on the angle, how wide the angle is. So once again, you can see this mental foramen over here. And then also in this picture, you can pretty easily see the symphysis here, the mandibular symphysis that's projected. Now, your maxillary bones or the maxillae, these two bones, they come together medially and they fuse. So they form the upper jaw and the central portion of the facial skeleton. Now, all the facial bones, with the exception of the mandible, they articulate with the maxilla. So this makes this the maxilla, a keystone bone for your facial skeleton. They carry the upper teeth in their alveolar margins. Now, inferior to the nose, the maxilla, it comes together, it meets medially to form that pointed anterior nasal spine at this junction. Now, the palatine process of the maxillae, it projects posteriorly from the alveolar margins and it fuses together medially at the intermaxillary suture, forming the anterior two-thirds of your hard palate. Or this is the bony roof of the mouth. Now, posterior to the teeth is a midline foramen called the incisive fossa. Now, this serves as a passageway for blood vessels and nerves. Now, the frontal processes, they extend superiorly to the frontal bone, forming part of the lateral aspects of the bridge of the nose. Now, the regions that flank the nasal cavity laterally, they contain the maxillary sinuses. Now, these are the largest of the paranasal sinuses. Laterally, the maxilla, it articulates with the zygomatic bones via the zygomatic process. Now we're going to be talking about openings for nerves and blood vessels. We've mentioned this incisive fossa and canal. So just posterior to the teeth at the midline, this is where you find this incisive fossa, and it acts as a passageway for bloods and nerves to pass through. Now, the inferior orbital fissure, this is located deep within the orbit at the junction of the maxilla with the greater wing of your sphenoid. Now, this allows the zygomatic nerve, the maxillary nerve, and blood vessels to pass to the face. Now, below the eye sockets on each side, we find the infraorbital foramen. Now, this allows the infraorbital nerve and artery to go to the face. So in this drawing, again, this is a maxilla. They have the zygomatic process that's been cut. Um, so you can see this orbital surface clearly. In addition to that, we also see the frontal process of your maxilla. Um, we have the infraorbital foramen you can see over here very clearly. And this is the anterior nasal spine. Also, you can see the alveolar processes where that's holding the teeth in place. So over here, again, you can see your maxilla over here. Again, these are the infraorbital foramen. You have the anterior nasal spine right over here. Let's see what else did we discuss. So this part right over here that articulates with your zygomatic bone. This is going to be called the zygomatic process. You also have so again, I think we discussed already described to you the alveolar processes over here. Um, did we talk about the anterior nasal spine? This is the anterior nasal spine. And then also when you're going up, you see this maxilla. It goes all the way and it articulates with superiorly. It articulates with your frontal bone and laterally with the nasal bone. So this part over here, this is uh, this region we call the frontal process over here. Now, as we move forward, it's called frontal process because it articulates with the frontal bone. Um, now, the this part right over here. Okay. Now, first of all, before we get to there, so we're looking at an inferior view of the entire skull. So this over here, these are the palatine process of the maxilla. So this forms the anterior 2/3 most of the roof of your mouth. Okay. Now this it's directly at the midline behind your teeth. You have this the incisive incisive fossa. And we call it the incisive fossa because these two teeth, these are called your incisors. So behind the incisors, you have this fossa, this incisive fossa, where you have blood vessels and nerves running through. Uh, so this is the intramaxillary suture, where both of these bones they come and they meet together. You can see the infraorbital foramen clearly over here as well. Uh, Also, I just wanted to point out to you that this bone over here, this is not part of your maxilla. This is the palatine bone. Now, it's a combination of both the palatine bone and the maxilla that produces the entire hard palate. Okay, so we're going to be talking about the zygomatic bone now. So this is an irregularly shaped bone. Um, More commonly, it's known as your cheekbones. Now they articulate with the zygomatic process of the temporal bones posteriorly, and the zygomatic process of the frontal bone superiorly, and with the zygomatic process of the maxilla anteriorly. So there's 3 points that this bone is going to articulate with the other bones. Now, zygomatic bone, it forms the prominence of your cheeks and part of the inferior lateral margins of the orbit. So now in this picture, you can clearly see this is a zygomatic bone, and you can see with the zygomatic process that it articulates with. So this part it articulates with the maxilla. Over here it articulates with the frontal bone, and this part right over here, this process here it articulates with the temporal bone. And also you can see that it's forming the inferior lateral aspects of the orbit. Okay, so this is inside here. This is where your eyeballs go. They're housed within this cavity over here. Now the nasal bone, it forms the bridge of your nose. Now this is a thin bone. Okay, it's basically a rectangular bone that are fused together medially. That end up forming this bridge. Now they articulate with the frontal bones superiorly, the maxillary bones laterally, and the perpendicular plate of the ethmoid bone posteriorly. Now, inferiorly, they attach to the cartilage that forms most of the skeleton of the external nose. We also have these lacrimal bones. Now, these are delicate. They're almost fingernail shaped in their form. So these bones they contribute to the medial walls of each orbit. Uh, Now, they articulate with the frontal bone superiorly, the ethmoid bone posteriorly, and the maxilla anteriorly. Now, each lacrimal bone, it contains a groove that helps form a lacrimal fossa. This lacrimal fossa, it holds the lacrimal sac, which is part of the passageway that allows tears to drain from the eye surface into the nasal cavity. So if you look over here, again, you can see over here, you can see the lacrimal bone right over here. You got your pair of lacrimal bones. Also, let's look at the nasal bones right over here. So again, you can see the nasal bones articulating with your maxillary bone over here, and also the frontal bone, right? And what else do we see? Thing, yeah. So yeah, and then we already spoke about the lacrimal bones over here. So again, these are very small, tiny bones. Both are actually the nasal bone and the lacrimal bones. Lacrimal bones are even smaller. Um, Now again, there's another view over here. You can see, this is the right side of the skull. So you can see the lacrimal bone over here, and also you can see the nasal bone over here as well. Um, you know, notice that the nasal bone is articulating with the maxillary bone and the frontal bone. The same goes for the lacrimal bone, which articulates with the frontal bone, as well as this bone here, the ethmoid bone. And then right over here, you're able to see this lacrimal fossa, and this is where you're going to find the lacrimal sac to be. The palatine bones, these are two L-shaped bones that are made from two bony plates. Now, these plates are the first one is a horizontal plate, and the other is a perpendicular plate. The horizontal plate, it completes the posterior 1/3 of the hard palate. Now, the perpendicular plate, it forms part of your posterior lateral walls of the nasal cavity and a small part of the orbits. The next bone is the vomer. This is a plow-shaped bone. It forms part of your nasal septum. We'll be looking at this in detail as we discuss the inferior nasal concha. So before we get to there, let's look at these bones again. So again, right over here, this is the palatine bone that we spoke about over here. Now notice it forms the latter 1/3 of the roof of your mouth. So again, it's the combination of this palatine bone and the maxilla that forms the hard palate. Now notice it's kind of like an L-shaped over here, right? L-shaped bone. That's how they describe it. Uh, Now this right over here, again, posterior to that, you have your vomer, and again, it's flanked by in this picture, it's flanked by the sphenoid bones over here. So again, when you look at this picture over here, uh, what are we looking at? So here, this is your sphenoid. This is part of your sphenoid bone. This is part of the sinus, the sphenoidal sinus. This is a pterygoid process of the sphenoid bone, and this is the palatine bone. Okay, of this of the palatine bone. Um, what else do we have here? Uh, so here's you have your maxillary bone over here. Um, So right over here, this is your inferior nasal concha. This is the nasal bone up over here this way. And then you have your superior nasal concha over here. And these are the frontal sinuses that we find over here. That's part of your the ethmoid bone. Again, this is another picture, cross section. This showing the pair of frontal sinuses over here. You can see the crista galli of the ethmoid bone over here. Uh, this is the sala turcica. This is where your pituitary gland is going to be sitting within this sphenoidal bone. And here's your sphenoidal sinus right over here. Um, and then this is the perpendicular plate of that ethmoid bone over here. As you go down, you can see clearly, you can see the vomer as well. And then also, again, you'll see the palatine bone and the palatine process of your maxilla forming the roof of your mouth. We have a pair of inferior nasal conchae bone. Now, these are thin, curved bones in the nasal cavity. Now, they project medially from the lateral walls of the nasal cavity, just inferior to the middle nasal conchae of the ethmoid bone. Now, these are the largest of the three pairs of conchae, and like some of the other ones, just like the other ones, they end up forming part of the lateral walls of the nasal cavity. So, if you look over here in this picture, so right over here is the inferior nasal concha. Okay, this is this bone that we're looking at right now. That's what we're talking about. All right, now let's move forward. Now the hyoid bone. This is not a bone of the skull. All right, this is actually the only bone in your body that doesn't articulate with another bone. It's actually suspended. Um, so um, a fun fact. So like when there's a murder or a homicide, and the body goes to the coroner, one of the things that they look at is to see if this hyoid bone is intact. If this hyoid bone has been fractured, then it's a highly indication that this individual suffered some type of trauma, such as strangulation. This bone, so it's like I said earlier, it's not part of your skull. Right, it lies inferior to the mandible, in the interior, in the anterior of your neck, and it kind of looks like a U-shaped, almost like a U-shaped structure. I mentioned earlier, this bone, it's floating. It's not articulate with any other bone. So it's anchored by this stylohyaloid ligament, okay, to the styloid process of the temporal bone. So it also it has a body, and it has a pair of horns, or we call the cornua. Now the hyoid bone, it acts as a movable base for your tongue. Its body and the greater horns, these are the attachment points for some of your neck muscles that raise and lower your larynx when you're swallowing and when you're speaking. So this is it. This is the hyoid bone. So notice where it's located. It's located in the uppermost part of your neck. So this is the body of the hyoid bone. This is the lesser horn, and this is the greater horn. Now we look at the orbits. Now these are the cavities that are holding your eyeballs in place. Okay, your eyes. In addition to your eyes, your lacrimal glands, they're also held in place over there. There's also a cushion of fatty tissue that's there that kind of acts as a shock absorber for the eyes. The muscles that move the eyes and the move the eyes, they're also housed within the orbits. Now the walls of the orbits, of each orbit, they're formed by parts of the 7 bones. Now we talked about these in the previous slides, so let's just go over it real quickly. They're the frontal bone, your sphenoid bone, the zygomatic, the maxilla, the palatine, the lacrimal bone, and finally the ethmoid bone. Now we can, in the next picture, we'll be able to see how all these bones, they come together to end up forming this, this entire 360-degree enclosure to protect and house these organs within it. So if you look over here, here's a picture of the right eye. So these are all the bones over here. Now it's very hard to see since it's not color coded, but you can see this is part of your zygomatic bone here. Your part of the maxilla is over here, and then this is part of the frontal bone over here. It's hard to see the palatine process, the ethmoid bone. That's forming it back there. You can see part of the sphenoid bone also over there. Let's see if there's another picture there. You can see it much easier. So here, this is the greater ring of the sphenoid bone, and you can see over here clearly. You can see this the zygomatic bone over here, as well as the maxillary bone over here. Let's see what else we have. Yeah, the maxillary bone here, the frontal bone. You can see over here that's forming the superior aspect of it. And then, yes, we can talk about the lacrimal bone over here is forming it, as well as the ethmoid bone back over there. So I think that's about it. We covered all these bones. So now we're going to be talking about the nasal cavity. So the nasal cavity, it's made up of bone and hyaline cartilage. Now the roof of the nasal cavity is formed by the cribriform plate of the ethmoid bone. The lateral walls, they're shaped by the superior and middle conchae of the ethmoid bone, the perpendicular plate of the palatine bone, and the inferior nasal concha. This is between the concha. These are called the meatuses, and we have 3 meatuses over there, and they are the superior, middle, and inferior meatuses. This the concha and the septum, they're also covered with mucus secreting mucosa that moistens and warms the air as it's coming through. So this does a couple of things. The first thing that it does, it helps clean the air of any debris that may be trying to enter. Also, the shape of the concha itself, it increases turbulence of the airflow from getting in. The floor of the nasal cavity, again, it's formed by the palatine process of the maxilla and the palatine bones. Now, the nasal cavity is divided into the right and left parts by the nasal septum. Now, the bony part of the septum is formed by the vomer inferiorly and the perpendicular plate of the ethmoid bone superiorly. The sheet of cartilage, that's called the septal cartilage, it completes the septum anteriorly. So when you look over here, again, we can see uh, here, we can see the frontal sinuses over here. Again, this is the superior nasal concha of the ethmoid bone, the mid nasal concha of the ethmoid bone. Um, Again, this is the nasal bone over here. Again, this is the same photos that we saw, the slides that we've seen earlier. Nothing hasn't changed over here. So again, notice the superior, middle, and the inferior meatuses. So here is the superior, the middle, and the inferior meatus. And over here, this is where you're going to have, so again, you see the structures over here. It helps create like a turbulence as the air comes through. It also helps moisten and warm up the air. So it's cleaning out the air, it's warming it up. And why do you need warm air? Well, think about it. If you guys ever go out into the winter time, when you go out into the cold and try to take a deep breath in, it doesn't feel so good. Now, when the air that gets into your lung, it needs to be warm. Okay, your lungs, it likes warm air. The cells over there, cold air, very cold air. It can't really utilize it. It's going to be low and it's not going to be utilized quite well. It's not tolerated very well. Um, so again, you can see the cribriform of the ethmoid bone over here, the crista galli also. You see right over there. Again, another photo that's showing the frontal sinuses, your nasal bone. Over here, you can see the vomer very clearly also. Uh, Now, the paranasal sinuses. So, the paranasal sinuses are formed from five skull bones: the frontal, sphenoid, ethmoid, and the paired maxillary bones. These are all mucosa-lined air-filled sinuses that give them a rather uh, a moth-eaten appearance when you look at it in an X-ray. Uh, Now, these particular sinuses, these are called the paranasal sinuses because they cluster around the nasal cavity. The small openings that connect the sinus to the nasal cavity and they act as like a two-way street. Air enters the sinus from the nasal cavity, and mucus formed by the sinus mucosae, it drains into the nasal cavity. Now, the mucosa of the sinus also helps to warm and humidify the air that we take in, that we're breathing in, which is called inspired air. The paranasal sinuses, they also lighten the skull and enhance the resonance of your voice. So again, when you are sick and when you're talking funny, one of the reasons you're talking funny is because these sinuses, they're full of mucus. You have congestion there. So this is why your voice sounds funny also, and your head feels very heavy as well, because you have all this extra gunk and mucus that's trapped within the sinuses. So again, this is what contributes to these sinus headaches that you have. So when you look over here, this is the frontal sinuses here, your ethmoid sinuses, your sphenoidal sinuses, and the maxillary sinuses. So this is why if you take like a Vicks, for example, or some type of eucalyptus oil, and you massage it over here, it helps to open up the passageways, and it helps to drain. Again, this is just a medial aspect of the same the sinus you're looking at. This is the frontal sinus, the ethmoidal ear cells, your sphenoid sinus, and the maxillary sinus. So this is it for the first part for chapter 7. So remember, we have two more lectures in this series, so stay tuned for that. If you have any questions, please feel free to email me or leave them in the comments below. If you like it, please give it a thumbs up and please share it. Thank you so much.